Hello, everyone. It's me, nurse practitioner Dr. Katina. I am here to give you all some health tips on urinary tract infection. I have patients that come into the office due to burning on urination, low back pain. Some people just have simple symptoms such as nausea. Also, some blood in the urine odors. Sometimes the color changes, the urine becomes cloudy. So those are just some signs and symptoms of a urinary tract infection. Now, not all the time you have those classic symptoms. I've had people come in and they just complain of just upset stomach. And I do a urinalysis in the office, a urine dipstick, and they have some bacteria in the urine, which can indicate that they may have some bad bacteria that we need to treat with antibiotics. One thing about urinary tract infections, you must treat, because if not, it can start in the bladder, but guess what? It goes up to the kidneys and it can cause a kidney infection. So that's why you don't want to ignore those signs and symptoms of a urinary tract infection that I just mentioned. Now, how can I prevent this from reoccurring? So some of the things that you can do is, remember, you want to wipe from front to back. All right. So when you go to the general area, you're going to wipe from front to back. You're not going to wipe this way. Okay, you're going to wipe from front to back. Don't hold your urine. Yes, holding your urine can cause that. Also, make sure you drink your water, cleanse that bladder out. If you drink or eat a lot of products, foods, drinks with caffeine in it, caffeine is an irritant. It irritates the bladder, and it can cause inflammation of the bladder lining, causing recurrent urinary tract infections. So you must stay away from caffeine if you are having them recurrently. So again, wipe from front to back, avoid high amounts of caffeine, urinate before and after sex. A lot of people, they just urinate after sex, and you want to get rid of that urine that's in there before, because what can happen is if the bacteria has some place to live or sit, I shall say, before you have sex, and then when it enters, it's gonna be there, and it's gonna irritate the bladder, and the signs and symptoms can get worse. So go ahead and empty that bladder before sex. Say, hold on, wait a minute, honey. Let me go empty my bladder. I know that may change the mood a little bit, but make sure you have some unscented wipes on hand, just so you can go ahead and get rid of that urine smell, so that you can enjoy that sexual experience that you are about to indulge in. But those are some tips. Again, wipe from front to back. Don't hold your urine. Urinate before and after sex. And if you do have them recurrently as well, make sure you can take like a cranberry pill. Cranberry helps acidify the urine, kill that bacteria. So if you do cranberry pill or cranberry juice as well. Now, though that cranberry helps it prevents. But if you have a urinary tract infection, it doesn't get rid of. So, just be careful with that. Again, if you have a urinary tract infection, you do need antibiotics to go ahead and get rid of that bacteria. Because if not, it will go up to the kidneys. Then you'll have to go to the hospital, and you'll get IV antibiotics. You'll be hospitalized. That's when you get the fever, the chills, and, things can get worse. So don't ignore the signs and symptoms, and make sure you follow me on IG at Dr. K, YouTube, Dr. Katina. That's where all my past videos are. All right, until next time, make sure you share this video.